One of the deforming forces that causes foot pain, typically acute pain, is equinus. The technique that I'm going to explain is used for plantar fasciitis, Achilles tendonitis, insertional or non-insertional, even if you have just hallux limitus sesamoiditis. I want you to incorporate in the majority of your procedures the therapy treatment that will release the plantar fascia, the Achilles tendon. So you're going to start up here. This is the popliteal fossa. This is where we stimulate the lymphatics and arterial blood flow to the body. And it's about 20-30 seconds. The patient will feel slight warmth due to this motion. If you hold it in one spot, it'll hurt. The next area you do is the heads of the gastrocs. And you want to put a little bit of pressure where the heads are. Because remember, the gastroc heads, the soleus, and the insertion are components of equinus. And you do over here. And then you go down where the soleus is. Now you notice here, you should have the patient hanging over the treatment edge. This is on a couch. But you want to have the patient, you can do it or I can do it, dorsiflex the foot to get motion. It opens up the fascial planes. It also will fire the treated tendon or muscle. Then you want to go down to the insertion. You can also get it on the sides. Remember, this area here, you got to keep it moving because it could be warm, too warm for the patient. We're doing 15 watts. You can go up to 25 watts, but I prefer between 15 and 20, depending upon which laser you're using. How's that feel, Jane?
Feels great.
Yeah. And you can do this. The whole treatment is between 5 and 10 minutes. Now, if we're doing the plantar fascia, we're going to, this area here, a little pressure, we're going to do the plantar fascia. If the patient feels or is tickled, you don't put as much pressure. And you'll do this, the majority of your treatment, if there's 100% treatment, 60% of it should be done where the pathology or pain is. In this case, it's the insertional plantar medial aspect of the plantar fascia. Okay, stop.